This video is going to discuss about episodic behavior, otherwise known as intermittent explosive behavior or sometimes just discontrol. As the name implies, the disease is a pattern of abnormal, episodic, frequently violent, and uncontrollable social behaviors, and this is characterized by intervals and occasional behaviors in the absence of significant provocation. These so-called episodes consist of recurrent attacks that may interfere with the life flow of the animal, meaning without these episodes, the animal lives a normal life. Episodic behaviors such as weakness, seizure, and aggression will be discussed in this video. The first behavior is episodic weakness, which is also called intermittent weakness. It refers to an involuntary falling over or collapse that occurs with exercise. Signs include ataxic or paretic gait, severe panting, reluctance to walk or run, lying down, and collapse. Muscle and nerves are tissues that generate electrical activity called action potentials. Action potentials are generated by the movement of sodium and potassium ions through the cell membrane. Movement of these ions is controlled by calcium. Disorders that cause electrolyte imbalances may produce episodic weakness. In the normal skeletal muscle, the fibers are stimulated to contract with the lower motor neurons. The fibers are connected to the lower motor neurons via the neuromuscular junctions. The motor end plates transmit action potentials to the muscle fiber, and this is stimulated by acetylcholine. Moreover, release of acetylcholine is modulated by calcium ion and is inactivated by acetylcholine esterase enzyme. Disturbances of calcium homeostasis affects acetylcholine and may adversely affect neuromuscular transmission, producing episodic weakness. Myasthenia gravis is an autoimmune disease affecting acetylcholine receptors. So normal muscle contraction occur at rest, but during work or excessive exercise, fibers will easily fatigue. This will lead to episodic weakness. For the diagnosis, history and physical examination may provide clues to the underlying mechanism of the disease. Neurological examination and muscle palpation are also valuable, since primary muscle diseases may cause pain. There is no reliable therapy for this problem. Rest is the only way for the muscle strength to improve. The next behavior is episodic seizure, which is the most common type of neurological problems in dogs. It is often assumed to be due to a genetic influence, but its exact cause is unknown. The behavior is commonly recognized in Labrador retrievers and poodles. Animals who suffer episodic seizure simply stagger and look dazed or confused for a few seconds or minutes and are unable to stand erect and walk, but they will attempt to crawl over to their desired location. Some will experience trembling or increased muscle tone during an episode. During a seizure episode, the membrane potential of neuron is altered in a way that causes neuron to be hypersensitive or overactive and undergo prolonged depolarization associated with rapid firing of repeated action potentials. Animals will have a dramatic frequency when treated with oral anticonvulsant. Phenobarbital is the preferred drug for dogs and cats because it is relatively safe and effective. Keep in mind that a successful treatment means reduction in severity, frequency, and duration of seizures, and not the complete elimination of the problem. The last episodic behavior is idiopathic aggression or rage syndrome. Breeds that are prone to this behavior include Springer Spaniels, Saint Bernards, Doberman Pinscher, German Shepherd, and Lhasa Apsos. Prior to outburst, the animal will have a glazed look in their eyes, like they are possessed. The cause of this disease is still unknown because this is particularly uncommon. But according to theories of behaviorists, idiopathic aggression is caused by, first, a damage in the area of the brain responsible for aggressive behavior, and second, it is a manifestation of status-related aggression triggered by a very subtle stimuli. Treatment is often difficult and unsuccessful because of its unknown cause. Prognosis is poor and many dogs must be euthanized for the safety of the surroundings. That summarizes episodic behaviors in small animals.